Our eyes, often called the windows to the soul, can also provide valuable insights into our overall health. They can be particularly revealing when it comes to autoimmune diseases, a group of conditions where the body's immune system mistakenly attacks its own tissues. Connective tissue disorders, a subset of autoimmune diseases, often manifest with ocular symptoms, highlighting the interconnectedness of our body systems. These ocular manifestations can range from mild discomfort to severe vision-threatening complications. Recognizing these ocular clues is crucial for early diagnosis and effective management of the underlying autoimmune condition. In this essay, we will delve into two such conditions: juvenile rheumatoid arthritis and systemic lupus erythematosus, focusing on their impact on the eyes. Juvenile rheumatoid arthritis, or JRA, is a chronic inflammatory disease that affects the joints of children and adolescents. While joint pain and swelling are the hallmarks of JRA, it's important to remember that this disease can also affect other parts of the body, including the eyes. In fact, eye involvement is relatively common in JRA, particularly in children with a specific subtype called oligoarticular JRA. This subtype, characterized by its impact on 4 or fewer joints, often presents with mild joint symptoms. Children with oligoarticular JRA may test negative for rheumatoid factor, a protein often found in the blood of adults with rheumatoid arthritis. However, they typically test positive for anti-nuclear antibodies, indicating an autoimmune process. These children are at a higher risk of developing eye inflammation, also known as uveitis. Uveitis can affect different parts of the eye, including the iris, the colored part of the eye, and the uvea, the middle layer of the eye. It is often asymptomatic in the early stages, highlighting the importance of regular eye exams for children diagnosed with JRA. Early detection and treatment of uveitis are paramount in preventing potential complications such as glaucoma, cataracts, and even vision loss. While early-onset uveitis is a significant concern in JRA, other ocular complications can arise, particularly in cases of chronic or poorly controlled inflammation. One such complication is iritis, an inflammation of the iris which can cause eye pain, redness, light sensitivity, and blurred vision. If left untreated, iritis can lead to the formation of adhesions between the iris and the lens, potentially impairing vision. Another potential complication is the development of cataracts, a clouding of the eye's natural lens that can cause blurry or hazy vision. Chronic inflammation associated with JRA can accelerate the formation of cataracts, leading to vision problems at an earlier age than expected. In some cases, band keratopathy, a condition characterized by calcium deposits in the cornea, the clear front part of the eye, can also occur. These deposits can cause discomfort, blurry vision, and even vision loss if they significantly obstruct the visual axis. These late ocular complications underscore the importance of long-term monitoring and management of JRA, even if joint symptoms are well controlled. Regular eye exams by an ophthalmologist are crucial to detect and address these issues promptly, preserving vision and preventing irreversible damage. Systemic lupus erythematosus, commonly known as lupus, is another autoimmune disease that can affect multiple organs, including the eyes. In SLE, the immune system attacks healthy tissues throughout the body, leading to a wide range of symptoms that can vary greatly from person to person. Ocular manifestations are common in SLE, affecting up to 30% of patients. Dry eyes, a condition characterized by insufficient lubrication of the eyes, is one of the most frequent ocular complaints in SLE patients. This can cause discomfort, irritation, a gritty sensation, and blurred vision. Scleritis, an inflammation of the sclera, the white outer layer of the eye, can also occur, causing pain, redness, and tenderness. More serious ocular complications of SLE involve the retina, the light-sensitive tissue at the back of the eye, and the optic nerve, which transmits visual signals from the eye to the brain. Retinal vasculitis, an inflammation of the blood vessels in the retina, can lead to retinal hemorrhages, swelling, and vision loss if left untreated. Hypertensive retinopathy, damage to the retinal blood vessels due to high blood pressure, is another potential complication, particularly in patients with poorly controlled SLE. Anticoagulant therapy, often used to manage blood clotting abnormalities associated with SLE, can also have ocular implications. While these medications are crucial for preventing life-threatening complications like blood clots, they can increase the risk of bleeding in the eye, potentially affecting vision. Therefore, close monitoring by both a rheumatologist and an ophthalmologist is essential to balance the benefits and risks of treatment.